My name is James Steckelberg. I'm a family practice physician here, and I've been here since 2005. Married and have 4 daughters at home. I'm originally from a small town called Osmond, and then went to medical school at UNMC, and then have been here since 2005. First job after residency. The reason I really wanted to go into medicine early on in my life, I don't remember exactly when. I've always just kind of been drawn to it. I've always liked science. I've always liked learning. I've always liked going to school. And one of my best friends back home, his dad was a local family practice doctor there. And so just kind of watching him really kind of got me interested in medicine, and then started the path after that. The big thing I like about family medicine is just the variety of it. So in terms of specialties, not necessarily. I mean, I like geriatrics. I see a lot of older folks, and I really like seeing them. But yeah, I like seeing the young kids as well, and everywhere in between. And that's kind of why I went into family medicine. It's not necessarily a procedural sort of career, but at the same time, we can do lots of different small procedures as well. So I really like the variety of it. And I started in Syracuse in 2005, and my wife actually is from Lincoln, and she's a physician there and was established there when I was looking for jobs. And then Syracuse is just, very close to Lincoln. I really like the small town aspect of small town medicine, small town philosophy sort of thing. So just reached out to them actually in 2005, and they actually had an opening, and like I said, I've been here ever since. The reason I stay here, I guess, is just the people. Both the coworkers, nursing staff, ancillary staff, and to be honest, mostly just the patients. Just the relationship that you develop with them. Being here for, going on 17, 18 years, it's just you develop these bonds with these patients, and it's a wonderful experience, and I can't see going anyplace else. The reason I really enjoy family medicine, like I said, is just the variety. I mean, you see patients from 2 or 3 days old to, I think the oldest patient I had recently was 104, 105 years old, and so you can just take care of them through their entire life, and it's just rewarding kind of seeing them transition from, whether it be a toddler up to watch them graduate through high school, or whether it be transitioning through someone with just any sort of medical crisis in their life, just kind of seeing and walking them through that. That's probably the most rewarding aspect of it. Oh, in my spare time, I like to golf, although I haven't played as much as I'd like to. Like to travel, so we are trying to hit a lot of different states across the country with the family, and just like Husker sports, just watching all sorts of sports. So being employed here at Syracuse Area Health, we both cover the clinic aspect and also the hospital side too, and then even we'll cover the ER sometimes as well. And typically most of my time is spent more over in the clinic, but if there is some sort of hospital patient that needs to be seen, then we will come over and work with the APPs on the hospital side and follow those patients. And also, like I said, from the emergency department, we're always available to help out in the emergency department as well. So get a lot of different variety in that aspect. Anytime someone needs to be in the hospital, we would prefer if we can ideally keep the patient here, keep them close to home, close to their loved ones, so that they can come and visit more regularly. And obviously there's patients that we can't take care of here, and if that's the case, we're going to get you on a bigger facility that they can take care of your needs. With that being said, there's all sorts of things that we can do here as well. And I think that also the future is changing too, with just some of the telemedicine that we're going to be able to do going forward. We can have some of those specialists as opposed to the patient having to go there to see them. I think that the way of the future is for the specialist to kind of virtually come and see the patient here. And so, like I said, we try to keep as many patients here, but then I think that's even going to be more exciting in the future with just some of the technology and things we have available.